For over 50 years, St. Leonard's Community Services London and Region has been dedicated to a community where everyone feels safe, valued, and supported. St. Leonard's accomplishes this by implementing and advocating for improved policies, procedures, and service delivery within the justice system through a range of services including youth and adult community programs, school-based youth programs, and adult residential programs. These programs are designed to assist persons in conflict or at risk of conflict with the justice system, all within a restorative practices framework. In this episode, I'll be speaking with a leader in community services about the importance of their work and the impact of restorative justice.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
My name is Gordon, and you're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in the fields. Michael Oates is the Executive Director of St. Leonard's Community Services, London and Region, a community service agency providing various supports to youth and adults involved with the justice system, struggling with homelessness and mental health challenges, and adults requiring support to live independently. Prior to that, Michael was a Senior Director of Operations and Quality at one of the largest family health teams in Ontario, serving over 160,000 patients. Michael led the development of a culture of continuous quality improvement in areas of patient satisfaction, access to services, and implementation of new streams of care. Michael has over 15 years of experience in large teaching hospitals and led several quality improvement initiatives, one of which was awarded the hospital's annual Quality Improvement Award. He has had experience in the private sector and has frontline clinical experience. He has also served as a member of a board of directors for an addictions and mental health organization and currently serves on the board of directors of an Indigenous-led organization providing holistic healing and wellness services. Michael has a Bachelor of Science in Applied Mathematics and Physiotherapy from Western University. He has been a guest instructor at universities in Ontario, as well as an invited speaker at governmental agencies in different parts of Canada. Michael, welcome to the podcast.
Gordon, thank you very much for having me on.
Perfect. So, Michael, you and I know each other from my experience as a student first, serving your organization, St. Leonard's Community Services, London and Region. And now I'm a member of the board of directors, and you serve as the executive director of the organization. So could you tell us a little bit more about St. Leonard's and your day-to-day role as the ED?
All right. Yeah, St. Leonard's, it's an interesting organization because there's so many different things that we do. So we've been around for over 50 years and started off what most people will know as a halfway house. Mm-hmm. So we served as a point of transition from people that had been incarcerated in prisons and that were making the transition back to the community. We were kind of that in-between step for them to get back to community living in a safe way and hopefully reduce the risk of reoffending or recidivism. Over the past 50 years, St. Leonard's has grown a fair bit. We still operate halfway houses, or as they're known now, community residential facilities. So we have 3 of those facilities that we run. 2 of them are for men and 1 is for women. We also have a 4th residence that we run that provides support to people that are involved in the forensic mental health system. So if you've heard about someone that has been found, for example, they've been found not guilty by reason of some type of psychiatric illness, they've probably spent some time in a forensic hospital. Mm-hmm. And when they're ready to come out of the hospital setting, but they need some support getting back to the community, they may come to us. Along with the residential programs that we offer, we have programs for a range of both youth and adults. So we have a support program. It's called a Supported Independent Living Program for individuals that are involved in the developmental services sector. So they are people that can live independently, but they need some support or some help with, it may be activities of daily living, it may be social interaction. It can be things that just to help them stay not involved with the justice system. We also provide support to youth. So youth that might be heading down a path that may not serve them well into the future, we can get involved with them early on and try and help them course correct so that they don't become involved with the justice system. We provide some supportive housing programs. So we have supportive housing programs for people that are perhaps struggling with mental health issues. And again, that may be bumping up against the justice system or getting involved with the justice world. And they need some support or some guidance to help continue living independently without getting involved with the law. And we also have a homelessness prevention program, so a Housing First program that we operate. It's a partnership with the City of London and various different community organizations, trying to deal with some of the homeless population that's in our city, some of the most unfortunate and marginalized people that live in our community.
Awesome. And we have a global audience, so for those who might not familiar with London, Ontario, tell us a little bit about London, Ontario, Canada.
So London is a city of about 400-ish thousand people. We're located southwestern Ontario, so many people will know where Toronto is. Many people will know where Detroit is. We're pretty much right in the middle. So it's an urban center. 400,000 folks. So St. Leonard's, we serve both the city proper, but we also serve the surrounding area. So to the south of us, there's a smaller city of St. Thomas, which is about 40,000 people. To the west is Strathroy. To the east is Woodstock. And we're surrounded by Middlesex County, which probably takes that overall population up closer to around the 550 or 600,000 mark.
Awesome. And I wanted to go back to something you said. So you were talking about essentially diversion. So you want to prevent recidivism. And so that's another exposure interaction with the justice system. So for, throughout the life course. And also it sounds like there's programs there to keep children in school. So recognizing that, even housing as a determinant of health and education as a determinant of health and the value that these services bring to the community.
Especially for youth, one of the biggest determinants of health is around that education piece, right? So the programs, you talked about diversion programs, or you mentioned diversion programs, Gordon. So for those that may not know what diversion is, if a young person, let's say a 15 or 16-year-old youth is apprehended for shoplifting. We'll just use an easy one that most people can identify with. They get apprehended for shoplifting. The arresting officer, so the police officer that works at the London Police Services, they have some decision-making ability about how they can proceed. So they can charge that youth with essentially a charge of theft, or they can choose to do what's called a diversion. So essentially what that means is they can say to the youth, I can charge you, or if you agree to go to St. Leonard's and participate in a course of programming, if you successfully complete it, then the charge will essentially be dropped. They won't file the charge. So it gives that young person an opportunity to take some corrective measures, you talked about some restorative measures to avoid getting into that, going down that path of becoming involved with the justice world, which is a place that, especially if you're 15 or 16, you can imagine what kind of impacts that might have later on in life, right? When you have a criminal record, that can affect employment. It can affect, so many other parts of your life. So diversion can happen like right up front, if like I said, when an officer first arrests someone, the officer they can certainly charge that youth. So they can charge them with the charge related to shoplifting. And when that youth goes before the courts, the judge can also choose at that time to divert them. So they may decide that, based on the history, perhaps it's the first charge, or, there may have been some type of mitigating circumstance. Right. The judge can say, you know what, want you to participate in a course of programming. And if you do, then the charge will be stayed. So the charge will have been filed, but there won't be any consequences from it.
So that's what two checkpoints there.
Correct. Correct.
Awesome.
So that's what a diversion program is. So that is certainly something that we see with youth. That can happen with adults as well.
Mhm.
So London is was one of 4 cities that were chosen across the or throughout the province of Ontario to be a pilot program for a justice center.
Mm.
And the justice centers are they're kind of a way that the provincial government is trying to sort out how they can do justice and criminal proceedings and those types of things in a bit of a better way. So
Okay.
anyone that's been involved in the justice system, there's a lot of delays. There's a lot of impacts on the court system and so on. So the whole idea of diversion or managing some of those, I don't want to say run of the mill because crime is never run of the mill,
Hmm.
but managing some of those more commonly seen charges
Hmm.
that might occur in a bit of a different way is a way to provide better outcomes for the individuals that are involved, but also to decrease the impacts on our justice system, which then has impacts on healthcare. It has impacts on so many other things, right?
Right. So you're saying for those bucket of offenses, so to speak, the goal of this is to sort of expedite this and create a better environment for those proceedings to happen. Is that sort of what you're getting at?
Yeah, to expedite it, but also to hopefully improve outcomes,
Mm.
because doing time in a provincial jail doesn't necessarily. There's not a fantastic outcome from that. I mean,
Hmm.
people don't get the chance to receive any type of intervention while they're there. I mean, they do the jail time, and then after however many months or days or weeks that they're in jail, they come out and there hasn't been any intervention to try and correct the behavior.
Mm.
So by sending the person to a justice center where we can provide the wraparound supports. So perhaps the individual is struggling with mental health related issues and we can facilitate a referral to a mental health agency.
Mm.
Or perhaps they're dealing with addictions issues and we can get the right addiction supports for them. Or it could be health related things. I mean, that happens as well. So we can provide those, like all those various supports. So the idea of the Justice Center is to provide that wraparound support for those individuals to get them what they need, because oftentimes what they need is not necessarily um, involvement with the police or
Right.
involvement with the justice system. It's health related things, and it's mental health, it's addictions, it's those types of things. So if we can provide those supports to those folks, then perhaps ultimately serve not only them better, but the broader system and then the community better.
Fantastic. And that makes me think about even just going back to the historical piece of it. So St. Leonard's, one of the reasons that the organization has stood the test of time is because of that track record of being able to respond to or even anticipate evolving community needs. So take us back to, I know at its inception, St. Leonard's played a major leading role in the halfway house movement in Canada. So tell us what a halfway house is and what was the intended purpose of that. And do those still exist today?
Halfway houses definitely still exist. The phrase that we sort of use in the industry
Mm-hmm.
is community residential facility. So I think the first one in Ontario was actually in Windsor by one of our sister organizations. So
Mm-hmm.
St. Leonard Society in Windsor, I think, started the first one in Canada
Mm-hmm.
or in Ontario. But we were not far behind, and it
Mm-hmm.
really started as a partnership at the time with a church. So in here in London, it was a partnership with a local church who wanted to provide support to those individuals that were coming back to the community after being incarcerated. So over time, it certainly has evolved. Now, when people are incarcerated, they'll often receive different types of programming while they're within the institution. So that programming can be. It could be things like anger management. It could be substance use. It could be a variety of different programs that they might offer. But when someone is getting close to their release date, and the way that the system works in Ontario, it's nothing if not complex. But once you've served about 2/3 of your sentence, you're eligible for what's called a statutory release. And if the Parole Board of Canada, which is a bit of a separate organization than Corrections Canada, which actually runs the institutions,
Mm-hmm.
so if the Parole Board of Canada says that the person is eligible for for release, they can make a determination that either they are free to go back to their community and they're on parole, which means they have to check in with a parole officer and so on. Or in some cases, they may be released with what's called a residency condition, which means they need a bit of extra supervision and a bit of extra support to try and reduce the risk of any type of reoffending or recidivism. So that statutory release with a residency condition, that's when they would potentially come to us. So we do an assessment before people ever get accepted to one of our residential settings. There's an assessment that's completed by ourselves, by parole officers, by our partners in the London Police Force. We have a community member that sits on that table. It's called the Community Assessment Table, or we call it the CAT table. And if we feel that person is somebody that we can work with, that we can manage the risk, and that's really what our biggest the most important part of that assessment is determining what's the risk to our community and do we feel that we can manage that risk successfully. So if we feel that we can manage the risk, that we can help them make that transition from an institution back to community, then we will accept that person and they may stay with us for 6 months. They may stay with us for longer. Within the corrections system, there's what's called the warrant expiry date. So somebody that's been sentenced to 3 years in prison, 3 years is their warrant expiry date. So when they hit that 3-year mark, they've essentially served their sentence and they are free to go. So they may stay with us right up until that warrant expiry date time period. Or we have within our institutions, we use what's called a level system. So as we sort of see how they're managing that return to the community. So that could be things like, are they participating in education? Have they secured a job? Are they working again? Are they participating in different types of programming? So maybe they need to receive support for addictions or mental health, whatever those things may be. If they are doing all of those things and we feel that the risk is manageable, they would move up through that level system, and at some point the parole office may decide that they have made enough progress that they are able to go and perhaps rather than living in a supervised facility, they need to go and stay with family, for example. So maybe they have a brother or a sister or a parent that lives within the geography, and they would go and stay with them until that they reach that the end of their sentence.
That's a great point. So I'm imagining these programs offer an alternative. People who've been out of the community for a while and not having the tools to adapt to the changed environment. This creates sort of that bridge before they were are able to go back and live maybe independently in the community.
Mm-hmm. Well, that's exactly right, Gordon. Mm-hmm. So, to give an example, I mean, we had one individual that was referred to us, and the individual had been in an institution for 18 years. I mean, think about 18 years ago, how much has changed over the past 18 years, right? I mean, things like cell phones and social media and the internet 18 years ago was not the internet that it is today. So I mean, so many things have changed and happened, and when you're inside an institution, you don't have the same exposure to those types of things. So when people are coming out and they're think about the job market, right? I mean, how much has the job market changed over the past 18 years? And we're trying to help people find suitable employment again, so that they can get an apartment, so that they can pay for rent, so that they can pay for groceries, those types of things. That can be pretty anxiety provoking for those folks that are coming out of an institution. And if we can provide some support and some structure for them while they make that transition, then again, that reduces the risk that later on they're going to revert back to behaviors that are less than helpful.
So talk to us a little bit about the school-based programming. So we talked about, restorative justice or restorative approaches. And can you situate us about where that fits and why it's important in that context of the schools?
Sure. So the primary tenet of restorative justice or restorative practices is really about taking ownership of harm that's happened and repairing relationships. And that's a tricky concept often for adults to grasp. I mean, oftentimes if we're harmed by another person, we think about we don't think about repairing the relationship. We think about either why did this person do this, and they're a bad person. We don't think about the act that occurred, and how do we repair the damage that's been done. So the idea of restorative practices is starting at that young age and finding ways to repair that relationship. So oftentimes we'll be asked to come into a school. So it may be a classroom, it may be just dealing with one or two students where there's been a significant conflict between those two students. And through a restorative practices framework, what we attempt to do is we attempt to move away from labeling, this person is a bad person because of what they did, to let's look at the behavior or the action that the person took, and what were the impacts of that action. Let's understand what happened, how it impacted the person that took the action, and how it impacted the person that was impacted by the action. So how did it affect both of those individuals? And then what's needed to repair that? So one of the things that we do is the person that was impacted by some wrong, we actually ask them, like, what would help you sort of recover from this or move on from this? Maybe it's an apology. Maybe they want, an example might be that there's a conflict between two students and one of them graffitis another one's house. So maybe that the repair is, I want you to come over and like, let's, fix the damage that was done to the house. That could be the consequence. So it really gets into sort of the natural consequences of what happened and how do we repair it. And by giving students the skills to deal with that conflict and to not only express themselves, but to help them hear what others have to say on both sides of whatever the conflict was, it gives them skills that are going to serve them better later on. Oftentimes, the alternative for a student that gets into some type of trouble at school is, the usual tools that most schools have are things like suspension or expulsion. And that removes the student from the conflict, but it does nothing to repair what was done.
No, I'm glad you brought up the point about the impact of those punitive measures of suspension and expulsion, and it might fix the problem for that one school where it occurred, and if this student goes to another school and doesn't learn the tools to maybe cope in that situation, it might even happen again. And herein the point of, justice diversion, that person's more likely to be involved with the justice system because they didn't get their full education, and you get that full cycle. So I'm glad it sounds like there's a suite of programs to address a variety of different things throughout someone's life course, which is, the best way to do it. The youth-based programming, there's the adult-based programming. Do you find, without going into too much detail, what are you hearing from the people that you serve, the benefits of it? And do you feel, even as the executive director, do you take comfort in knowing that you're having an impact on the community by, having these programs?
What I see, which is probably a fairly good indicator, is the number of requests that we get for our staff to go into work within the schools. So we get requests directly from teachers, we get them from principals and vice principals at the schools. Our school-based programs working with youth through a restorative approach, they are probably one of our most demanded or our most in-demand programs. We tend to see a lot of requests for that type of service. To the point where, so throughout the past year, obviously the pandemic has impacted schools fairly significantly and has impacted youth, and many schools, and for folks out there that are listening that may have children or maybe involved in schools themselves, they probably know that schools essentially really limited access to the school environment. So it was the teachers and the students. So parents weren't allowed in, contractors weren't allowed into the schools. The school boards that we work with, we were one of the few providers that they actually asked to be coming back in and doing in-person, in-class interventions with the students, because they see the value of what we do, of that restorative approach. And one of our programs is called a peer power program, which works with an entire classroom to try and help that classroom figure out how to be better together. So we have certainly seen the demand for our services over the past 9 months or so, and certainly within the school year. So schools have been back in for about 3 going on 4 months at this point. The number of requests that we're getting from the school board to come in and provide support to their students is quite significant. So I think that we've talked a lot about the impact that the pandemic has had on youth and some of the mental health challenges. And I think what we're seeing is the expression of the challenges that those students have been experiencing over the past 18 or 19 months.
And how do you, as the executive director, overseeing the organization, leading the organization, how do you ensure that those high standards are kept up to serve the clients?
So, Gordon, over the past, since we've been talking, there's a lot of different things that we've talked about, right?
Mm-hmm.
Everything from youth to diversion to residential facilities. There's no one way to measure the impact of what we do. So we kind of go about it in a few ways. One of them is making sure that we are doing things according to the highest standards that we possibly can. So our organization, a year ago, we received a 4-year accreditation through the Canadian Centre for Accreditation, for example. So that accreditation, that is a fairly intensive process. It was about 2 years of work to get us to the point where we felt that we were ready to go through it. And accreditation looks at all of the different things that we do. So it looks at everything from our human resources standards. So, how do we function as an agency from a human resources perspective, from a stewardship perspective. So because of the type of work that we do, we get funding from the federal government, from the provincial government, from our municipal government. Are we good stewards of those funds that comes to us? But a lot of the standards that are involved in accreditation are about the provision of services. So the people that we're serving, do they have a say in the services that they get? Do they have a way to, if they have either a complaint or a compliment, are there processes in place so that they can either share those concerns or share their compliments with somebody like, whether it's me or with our board of directors or with the managers or with the staff that are directly providing services. We give all of those folks that are participating in any of our programs, they're all invited to complete an experience survey, right? So it's not a satisfaction survey, like were you happy with the service that you received, but were you treated respectfully? Did you have the opportunity to provide input into the course of care that you received? Like, did you have a say in things? Were you provided with the resources so that you could continue to be successful? So we try and look at it from a number of different ways. Of course, because of the fact that we work with so many different levels of government, there are metrics that we have to measure and we have to meet. Those things are often about sort of the number of people that we serve and how many hours of service are we providing, and how many days are we have residential centers, so how many days are those beds being filled versus sitting empty, right? So we monitor all of those types of things as well. Another big part of what we have to do is we have to look at how our staff are doing, because the work that we're doing, it's not easy work, right? Like the people that work within this agency, Gordon, they are some of the most phenomenal people that you'll ever have the chance to work with. They are here for all the right reasons, and oftentimes they're doing work that other people aren't interested in or don't see the value in, right? Like when you're working with people that have been involved in the justice system, or maybe they've been in prison, like that's not a population that a lot of people want to be involved with. They don't see the value in that. But the people that work here, the people that work across the organization, they see how they can really impact not only the person that's in front of them, but our broader community, right? Those people are coming back to our community, whether they have supports or not. If we can provide supports and help them be more successful, that ultimately contributes to a safer community. Right?
Absolutely. So you've been in this role for a while, but I know your career didn't start there. So how did you're in public service now? How did you start there? What were you set on the path of doing when you first came out of school?
So no, I certainly did not expect that this was where I would be years ago. So I started my career in the mid-90s as a physiotherapist, actually. So started in the healthcare world. I worked in hospitals for over 15 years. But one of the turning points for me was I started working in a chronic pain program. Physiotherapists are it's a fantastic profession. So to all the physios out there, keep it real. Physio is a great profession, right? I mean, you get to see people after injuries and after surgeries in hospitals, like you're getting them up after they've had, in some cases, life-altering events and helping them through a rehab process. And physios are really good at dealing with sort of the physical aspects of what those injuries are. When I was working in a chronic pain program, I got to see the experience or to see the impacts of how mental health and physical health really sort of combine. Because people that are experiencing chronic pain, I mean, these are people that, in some cases, 2 or 3 or 4 years, they haven't been able to work. They haven't been able to fulfill a lot of the roles that they would have at home. Like they haven't been able to do things. It impacts their family. So, depression and anxiety, those are very prevalent in that group. And I got to see how those things interact. That really changed my viewpoint, because I saw that it's not just about, treating somebody that has neck pain. Like I can certainly, treat somebody with neck pain, but I can't help them recover the roles that they had at home, or their sense of worth, or kind of all of those things. So I saw a very different part of it. And then while I was there, then I started making a transition into different leadership roles. So I moved into a professional practice role. So I was sort of overseeing an interdisciplinary team that included physios and occupational therapists and psychologists, and like from a variety of different perspectives. And then that professional practice role turned into a manager role. Then I got to work in the primary care field. So I was working within a hospital system, and I had responsibility for a family medical center. So, you're thinking like family doctors, nurse practitioners, social workers, sort of that side of things. And again, seeing the impact that that primary care has on the trajectory of a person's life. I mean, oftentimes the people that have a family doctor, that family doctor is often a pivotal person, in a lot of people's lives and a lot of people's experience, especially when you start seeing people experiencing chronic health conditions and so on. Like the importance of that role in helping that person navigate the system, quite frankly, became really key. But all along the way, I was seeing how I could help teams from a leadership perspective than a direct service perspective. When it came to St. Leonard's, so I've been with St. Leonard's for going on 4 years now. I knew about the organization before I ever came here, and one of the things that I always heard about it was how the organization was the type of place that would take those people that nobody else could provide service for. And being able to be a part of an organization like that, I mean, that spoke to me and the values that I had, and there was a really good alignment of sort of what my values were and what the values of the organization were. So coming here, it kind of felt like when you're doing something you love, it never feels like work. And that's kind of what I experience on a daily basis.
And then you're at work right now recording this podcast. So there you go.
Right? Yeah.
So, just to wrap things up, what would you've chronicled your experiences and how you ended up, living and working on what you're passionate about. So what has been the most impactful lesson you've learned so far throughout your career, or even just as the executive director for St. Leonard's?
Oh, Gordon, there are so many to try and choose from.
There you go. I knew I would get you on that one.
I think one of the most important things that I have learned is work with great people and let them do their jobs. Like basically, get out of their way and let them do what they're good at. With the types of services that we're providing and the types of people that we serve, it's not something that any one person can do, right? Like anytime we have success, it's not because of me. It's because of the people that are providing the services. But if I can make the system work a little bit smoother so that they can provide those services without having to worry about like what's happening in the background, or, do we have the right structures in place, or do we have the right funding in place? I'm happy to take care of all of that so that the people that are providing the services can do what they are fantastic at doing.
Okay, that's well. So what you're saying is, so you're responsible for ensuring that the organization recruits very compassionate, talented people, and then from there you're trusting in them to do the work that they're called on to do, and then you're responsible for ensuring that the system enables them and empowers them to do impactful work. Is that kind of
That's exactly it. Very well said.
Perfect. And then on a more, maybe even bigger picture note, in terms of your role, St. Leonard's, and the populations that you serve, even the programs that you offer, what are your key take-home messages for our audience?
Key take-home messages. Oh, that's a great question as well. So I had the opportunity to talk with one of the staff here at the organization, and what she had said was like, the organization does great work. We need to help people understand why it's important, which is a really interesting way of looking at it, because we've talked about the people that are involved in the justice system, and they're coming to our community anyway, right? So we have an impact on our community. We talked about youth, and if youth start heading down the wrong path and getting involved with the justice system and sort of bumping up against the criminal justice world, that has long-term impacts not only for them but for their families and their communities. So if there was anything that I could say, it would be like, when you see an organization like St. Leonard's that works with a population that a lot of people don't understand, and people may wonder, like, why would anyone want to work with people that have been incarcerated? Right. Have a sense of compassion and a sense of understanding that good people can make bad decisions, right? And a colleague of mine once said, we're all one bad decision away from being one of our clients, right? It can happen to anyone. I mean, if you think about like homelessness, for example, I mean, people that that are homeless never thought that's what they would be, right? When they were in their teen years and they were living at home, they never expected that they would be, homeless and perhaps sleeping rough and, struggling with substance issues. And it's easy to think that, what, like that person just needs to go and, get a job and like stop using drugs. It's really not that easy. I mean, there are so many factors that often conspire against us. So if there's one takeaway that I would say, it's, have some compassion and some understanding that these people are just as worthy of the services that we provide as anyone that's going to seek care.
That's a great place to end it. Thank you, Michael. This was
Michael
Oates, the Executive Director of St. Leonard's Community Services, London and Region. Thank you, Michael, for sharing your passion with us and why it's important for us to support this great work that you're doing in the community.
Gordon, thank you so much for taking the time to speak with me. It's been a pleasure.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.